So if we put this algorithm or this diagnostic chart into a table, we get the basic rules for ultrasound diagnosis in a Doubilet ectopic patient. And here are the basic rules for ultrasound diagnosis based on what I've shown you up to this point. If the ultrasound finding in a Doubilet ectopic patient is an adnexal mass with a heartbeat or yolk sac, our interpretation is definite ectopic pregnancy. If the ultrasound finding is an adnexal mass outside the ovary without a heartbeat or yolk sac, we have a probable ectopic. If there's a moderate to large amount of free fluid in the pelvis, we also have a probable ectopic in this patient, again, that has positive pregnancy tests and symptoms. If the scan is normal, and that is with or without an intraovarian lesion, so the normal means nothing in the uterus, nothing in the adnexa outside the ovary, then our interpretation of the ultrasound should be a probable but unlikely, a possible but unlikely ectopic pregnancy, about 5%, or we could say can't rule out an ectopic because the chance is 5%, but it's low. And finally, if we see an intrauterine pregnancy, then ectopic pregnancy is virtually excluded. But we would still check the adnexa to see what we see. So here, the next several slides will be some ultrasound examples of these basic rules. Here's a definite ectopic pregnancy. There's a live embryo outside the uterus. Here's the uterus on a transverse or coronal transvaginal view of the pelvis. And here in the left adnexa, we see a fluid collection surrounded by a bright ring called a tubal ring. But more importantly, we see an embryo inside. And how do we know it's an embryo? Because on this companion video, we can see there's a heartbeat inside. So this is not just a probable ectopic pregnancy, it's a definite ectopic pregnancy because we're seeing a live embryo outside the uterus. Here's another definite ectopic pregnancy. Woman comes in with a positive pregnancy test, pain, bleeding. We do an ultrasound, and on the ultrasound, we see nothing inside the uterus, but here in the left adnexa, we see a tubal ring, fluid collection surrounded by a bright ring next to the ovary but not in it. And importantly, inside the tubal ring is a yolk sac, seen here. So because there's a yolk sac, this is a definite ectopic pregnancy. There's a gestational sac with a yolk sac in the adnexa. This is an example of a tubal ring without an embryo or a yolk sac, nothing in the uterus. There's some free fluid, but very importantly, here's the ovary. But beside the ovary, outside the ovary and beside it, we see a fluid collection surrounded by a bright ring called a tubal ring. Because there's no yolk sac or embryo, we can't say there's 100% likelihood of an ectopic pregnancy, but it is highly likely, over 90% chance of ectopic because of the tubal ring. Here's another example of a Doubilet ectopic patient where we see nothing inside the uterus, and in the adnexa, that's the edge of the uterus, there's the right ovary. Between the ovary and the uterus, we see a solid mass. What is this solid mass? Well, we don't know for sure what this is. It could be an infection, it could be a tumor, but because this is a Doubilet ectopic patient, in other words, she has a positive pregnancy test and some pain on that side, when we see this solid mass, that likely represents an ectopic pregnancy. So she has an over 90% chance of having an ectopic pregnancy because of this solid mass. Another woman comes in with a positive pregnancy test, pain, bleeding, and we do the ultrasound. We see nothing in the uterus, but in the adnexa, or in the pelvis outside the uterus, we see a large amount of free fluid and clot. Here we are on a transverse or coronal view, transvaginally, lots of free fluid and some clot. In view of the fact that we see a large amount of free fluid and clot, this woman who has a positive pregnancy test has a very high likelihood of having an ectopic pregnancy. So I've gone over the basic rules of diagnosing ectopic pregnancy. Life isn't always so easy that we can apply basic rules. There are some problems or pitfalls that one can run into in diagnosing ectopic pregnancy. I said earlier that there are two key questions when we're doing an ultrasound. Number one, does the ultrasound demonstrate an intrauterine gestational sac? And number two, are the adnexa outside the ovary normal or not? Each of these has some pitfalls when we try to answer them. In some cases, there's some problems. So first, does the ultrasound demonstrate an intrauterine gestational sac? A potential pitfall here is confusion between a gestational sac and what's been termed a pseudo-gestational sac. And we'll get into that in a few minutes. And the second question is, are the adnexa outside the ovary normal? Well, it's not always so easy in real life to distinguish an intra-ovarian from an extra-ovarian lesion. There can be confusion between the two, leading to difficulty or a pitfall in answering this question. So let's take a look at these potential pitfalls. Here are two patients with two rule-out ectopic patients. They have positive pregnancy test, pain, bleeding. They come for an ultrasound, and two different patients, but similar findings. In each one of them, we see a little fluid collection in the uterus. I would call it, these are so-called non-specific fluid collection. What do I mean by non-specific? Well, they have little rounded edges. There's no double sac sign. DSS is double sac sign. There's no intradecidual sign. There's no yolk sac. There's no embryo. Just a little non-specific fluid collection in the uterus in these women who came in for as rule-out ectopic patients. So when you look at them, one question might be, is this a gestational sac sitting here outside of the uterine cavity, which is a collapsed cavity and a gestational sac? Or is it just some fluid inside the uterine cavity, which would be a so-called pseudo-gestational sac? It makes a very, very big difference. If we say that these are pregnancies, intrauterine pregnancies, then the patient would go home and be told that she has no ectopic pregnancy. On the other hand, if this is fluid in the uterine cavity, namely a pseudo-gestational sac, then there would be great concern for ectopic pregnancy, and she might be treated with medications such as methotrexate for an ectopic pregnancy. So how do we deal with these non-specific fluid collections in a rule-out ectopic patient? How do we know whether they're gestational sacs or pseudo-gestational sacs? Interestingly, on both of these patients, a week to a week and a half later, when each of these two women came back, these non-specific fluid collections turned out to be pregnancies. You can see on these videos of each of them that there's a week or week and a half later, there's an embryo with a heartbeat inside the uterus. So how could we tell at the earlier date that these were pregnancies when they didn't have any special features of pregnancy? So the potential error that can happen here, and unfortunately I've seen this error occur too many times, is that a woman might come in as a rule-out ectopic patient. The ultrasound shows a non-specific fluid collection. The interpreter, the doctor interpreting the scan, says this is a pseudo-gestational sac. The patient gets treated with methotrexate, and that ends up damaging an intrauterine pregnancy. The potential consequence of mistaking these fluid collections for pseudo-gestational sac is that the patient may receive a treatment that damages the pregnancy, such as methotrexate or DNC, either of which can damage an intrauterine pregnancy. So how do we deal with these?